Yo, you tapped in, no filter, no fluff, real rap every time. Yeah, we talking about health, from the boardroom moves to the barbershop facts. We keep it 100, never turning our backs. Mine sharp like a suit with the fade on point. Every convo cut deep, this ain't just for the joint. It's the culture, the hustle, the game and the grind. You looking for truth, then you came to the right line. Keeping it 100, facts versus feelings. Keeping it 100, truth with no ceilings. Keeping it 100, no cap, just vision. We speak it, we live it, your health is our mission. Keeping it 100, facts versus feelings. Keeping it 100, truth with no ceilings. Keeping it 100, no cap, just vision. We speak it, we live it. Your health is our mission.
Hey. Welcome to Keeping It 100, where we have these open and honest conversations to make sure you have the information you need to take good care of your health and, most importantly, to make informed health decisions. I'm your host, Dr. Kristin Motley, and I'm joined by the one and only street practitioner, Georgie Mink Jr.
Hey. Good
Hey,
evening.
G.
How you doing?
I'm all right. How you doing?
I'm good. This weather is clearing up a little bit. We can see the streets and the grass, and
The streets is back.
yeah, that snow tore us up, Doc. Woo.
Yeah, it did. It was lingering. I was like, we're going to have snow till like May.
Yeah. So
I hear it's another little something that's rumbling that maybe we may be getting more. I don't know how much. Have you heard anything?
I did, and it was light, so I'm
Oh,
not
okay.
sure, but it is supposed to be something. But I think we should be good for our deal this weekend.
Nice.
Right.
Very good. Very good.
hmm
Yeah, we got work to do this weekend.
Oh
We all
yeah.
be outside. We don't need
hmm
no snow.
No, we don't. And it
No
was cold
snow, no
last time.
sleet. It was
No,
cold. Yeah.
right.
We're going to be cold for sure. But we'll talk about that in a little bit. We'll talk about what we're going to be doing this weekend. You started a new job.
Oh yes,
Congratulations.
yes. I'm a career counselor.
Let's
Yeah,
go.
at Maturity Works, and we sit
Congratulations.
the senior crowd, and it's just helping them get that training back up to enter the the workforce. And
Okay.
so we're looking for nonprofit hosts so we can pay you guys to keep our trainees. Yeah,
Hey, let's do it.
yeah.
Let's absolutely do it. You got a nice posh hospital. I mean, I say hospital office.
Oh yes, yeah. We
That
got koi
office is
fish
nice.
in the lobby, and yeah, it's a beautiful atmosphere. Yeah.
That's good. You deserve it. You
Yeah, I
deserve it.
appreciate it, Doc.
Yeah, it is American Heart Month, as you all know. Gee, what's up with your blood pressure?
We good.
You
We
be telling
good.
me that. I can't wait to
All right,
sit
I'm
you
gonna start. You
down.
know what? I'm gonna start sending you my readings because I usually check it like 3 times a week. I don't check it every day. I'm gonna be
Very
honest,
good. I like
but
that. A
I
couple
take my
times a week.
blood pressure. I'm always on point.
I'm
But they
glad.
did change. They did change it though, Doc, because I did find out that the first one, the nifedipine, causes swelling, and I didn't know that. So I stopped taking it, and then they put me on. I forgot what the new one is called. But
Amlodipine. It start with
yes,
an A.
yeah, exactly, yeah,
But was it causing you to have swelling? The
yes,
nifedipine? Oh, it was?
yes. And they
Okay.
said that's one of the side effects,
Yeah. Mm-hmm.
and that's why I
Okay.
stopped taking it. And then, of course, that's not good. So,
But I'm glad you had a conversation with your doctor about
yeah,
that because that's what's important, really, is to be talking to your provider. When you don't want to take something, let them know.
right,
And if you don't feel comfortable enough telling them that, then you might need to look for a new provider because you have to have those honest conversations because they don't know how to best help you if you don't tell them what's going on. And
right,
so, excellent job communicating with your provider so that they could make the adjustments that they need to find a medication that works best for you. I'm proud of you, G.
yeah. Thanks, Doc.
Well played.
It's been a long trip. It's been a long trip, but we
Oh,
finally here, Doc. So,
you you're doing great. I'm I'm
right,
I'm happy to hear that your numbers are good. But I'm still
yeah.
gonna check for myself
Oh yeah,
because
yeah. You
you
can
just be telling me
check them
anything.
on Saturday. I'm quite sure you got like 10 blood pressure cuffs in the car.
I
So
do.
sure, yeah. So check it on Saturday. They're
I
approved.
am. I am.
Yes. Okay.
Just want to acknowledge the death of a man who has been a towering figure In our lifetime, the Reverend Jesse Jackson passed away at the age of 84. You all know him as a longtime civil rights hero. He fought for justice and equity for our communities for so many decades. I watched the press conference that his children held today, and they just said so many wonderful things about their dad. And it was great to hear the dad side of the person because we always saw the fighter side. So it was nice to hear from his children. So just wanted to acknowledge him and his work. I'm really appreciative for all the doors he knocked down for us to, to be able to take advantage of the things that were not available when he was young, but that's available to us right now. Today I learned that he went to prison for um because he wanted to go into a library that was not for black people, and he got jailed for that. And so
Mhm.
people sacrifice a lot for us to have the freedoms that we have, and a lot of times we take that for granted. So just wanted to acknowledge him.
Yeah.
Any special moments that you have of Reverend Jesse Jackson? G,
No, I mean, all
like,
the times I seen him, he always was on the front line.
mhm,
And he was with Martin Luther King.
mhm,
Solid brother. He, I know he has a organization, a Rainbow Coalition, if I'm not
Book
mistaken.
coalition, yep,
Right,
mhm.
right. I didn't quite sure know what it was, the details of it, like what it was geared towards, like what type of impact. But I didn't do my homework on it. But I know it was like a big
It's a
organization.
civil rights organization. Yep.
All right. Okay.
Yep.
Okay.
That's the civil rights organization. Just advocating for the people.
Okay.
Advocating for the people. One thing that his children said that he always taught them that really resonated with me was that he taught them you don't have enemies, you have opponents. And so that
Mm,
was like crossing, being willing to cross the line and talk to people that you didn't always agree with, but try to maintain good relationships with everyone, even though they may not agree with you, because you don't need to be enemies. Like you don't need to hate each other. And I feel like in a lot of the spaces that I'm in my other role, I feel like that's something that I really want to take with me as I'm
mm-hmm.
trying to, build coalitions and build support for Chester. There's a lot of people that's not with Chester, that's like against us.
Yeah.
And so I shouldn't look at them as my enemy. They may be opponents, so we can still be cordial and have relationships so that way we can have productive conversations and move toward what I want to move toward.
Yeah, pretty
So
much.
that was good. I
Yeah.
appreciated hearing them talk about that.
Yeah.
So R.I.P. Reverend Jackson. Um, so news wise, one thing that came up recently is that companies, these food and drink companies, there was a study that was done to say that they are like overly advertising to kids, and that major brands like Coca-Cola, Campbell's, General Mills will start pulling back on the advertising that they're doing to children. Like our kids are spending so much time online and on different digital platforms, and a lot of times, they're picking up whatever ads are coming up. And so a lot of the ads in terms of food and drink ads, a lot of them are pushing unhealthy food options, like unhealthy food brands. And so our children are just, they're sponges. They're absorbing that information. And it's funny because when I take Noah to the store, we was in a market re- re- recently, and he was like, "Mom, oh, I want you to buy me Red Bull." And I was like, "Boy, I ain't buying you no Red Bull." He was like, "Mom, please, I want some Red Bull." He's 6 years old. He was like, "I want Red Bull." He's like, "Please, Mom." I was like, "What do you even know about Red Bull? Why do you want Red Bull?" He gonna say, "Because it gives you wings." I was like,
Yo.
"Boy." Said you gotta put down that iPad. This is like too much
Yo.
iPad time for you to say because it gives you wings, and you are begging me in the middle of this market about buying you some Red Bull. And
Wow.
so it was really at that moment that for me, and this was like a month ago, I was like, yo, this is just too much. These people need to stop advertising to our children. Like,
Right.
why are you advertising Red Bull to a 6-year old? Because you want to make money. But
Right.
that's ridiculous. Like there has to be a line drawn at some point there has to be a line drawn. I don't know. Do you see stuff like that with your grandkids, like asking for stuff that?
I just think it's really up to us to deflect it. So, advertisements been out for years,
Sure.
even when we were young. So, the kids just got more access to different, avenues and different things to be exposed to more commercials. But it's probably basically going to depend on what the parent is allowing, because it's a regular commercial. It's not really geared towards a 6-year-old because he can't go in the store and buy it.
Oh, it's
But
geared to him. So it's in his
I'm
brain.
just
He
saying,
can
but he
ask his
can see.
parents.
I'm just saying he might not have the money, but he's going to ask mommy. And it's crazy because you probably could have got if you would have went viral. You probably would have went viral for it, and they probably would have paid you if they would have.
I should have did that.
Heard Noah say that we might be rich today, Doc. So
Listen, every time that train is never late. Every time we walk past the kid, he asking for Red Bull, and I gotta explain to him because he wants the answers. He wants to get to the bottom of everything. When he believes it gives you wings, I have to explain it to him that it does not give you wings, and he doesn't understand how. Not because he saw the person get wings,
and
and
they
it's what
said
they
it.
said on the commercial.
He saw them fly away. And he drunk it and he gained some wings. No, that's not how you get your wings, bro.
So now I gotta sit 5 extra minutes explaining to him how this is not real. It is exhausting. So thank you, major brands, for pulling back on advertising to kids because it's not productive.
Right.
At all. And for so many reasons, it's not productive.
Yes, it's not.
The next thing I want to mention, there is a serious recall on Libre 3 sensors. So if anyone knows anyone who has diabetes who are using these Libre 3 sensors to track their glucose, they are giving bad readings, and the bad readings have led to a number of deaths across the country. So so the specific lot numbers are getting called and recalled. So please call your pharmacy, give them the numbers on your box so that they can let you know if there has been a recall. There has been at least 800 um, serious injuries and 7 deaths so far. So please make sure you call your pharmacies or call your doctor's office to check the lot number to see if you have a defective product. This is a really, really big deal. They're not giving you the right numbers, and so when they don't give the right numbers, then you don't take the right amount of insulin, and it causes a big problem. Or you don't take any insulin, which causes another big problem. So check your Libre box, please, people. But yeah, that's it in the news topics today. We're gonna switch over and bring in our esteemed guest, the Honorable Stefan Roots, who is the 33rd mayor of the city of Chester, Pennsylvania. He
Roots,
is
there it is.
Roots, there it is. I think you said that last week.
That was his first campaign. We ran on that.
That is awesome. A Villanova University educated electrical engineer, he has transitioned from a diverse career in energy and IT industries right on over to public service. He was previously a Chester City councilman, and as mayor, his administration focuses on leading the city through its municipal bankruptcy by prioritizing public safety, financial stability, and neighborhood revitalization. Welcome to the show, Mayor Roots.
Hey, good evening.
Hey, I got to hit that mute button. Hi, y'all. Good to see
Hey.
you. That segment was really fire.
Oh,
I
thank
was
you.
sitting here enjoying that.
Okay.
Thank you. Thank you.
Break for you to come back, but I guess I'm the comeback. So
there ain't no breaks. We just work right through it. So I just want to clarify who I am because I wear a couple of different hats. Tonight, I am the founder and executive director of Health Educated. So you cannot be pivoting questions to me as your health commissioner unless you really need to. I got your back.
Okay.
But I'm primarily representing Health Educated and making sure our people have the information. That's all.
So let's go.
All right, let's go. So just to start us off, you won the election, you became mayor, And so we're wondering, where does health fit into your priorities for the city? What does a healthy Chester look like to you?
Well, if I were to wave a magic wand, a healthy anywhere would be no one ever gets sick, no one ever gets ill. And we know that's never going to be the case because
Mhm.
people like you, Dr. Motley, would be out of work.
That's
People
true.
who
Mm.
spend years as, doctors and surgeons and mental health professionals would never have work. So, we're here for a reason. And even if we thought that we can create a space where everybody stayed healthy, that would mean that, hmm, not that pregnancies are unhealthy, but you need that medical body to help you get through a pregnancy. And somebody's going to get a paper cut, and somebody's going to fall down the steps, and someone's going to be in an auto accident.
Mhm.
One of the things that does make a healthy community was demonstrated in your dialogue with each other when you were talking about George and his blood pressure. Like if everyone had someone that they were comfortable with to just talk about their sniffles and their itching and their headaches and their tummy problems, that would be a big help.
Mhm.
Guys in particular don't do their checkups when they should. Guys and gals are scared of the dentist, so they're not there every 6 months. We have to be comfortable in the health space. Now, what could really help everybody, not just the providers and not just the individuals and not just the residents, is a way to pay for health services. So many people disregard healthcare because they think they can't afford it.
Mhm.
And in many cases, they can't afford it. It's been made a whole lot more difficult in the last few months, where we see tens of thousands of people giving up their health insurance because the subsidies that they used to count on are no longer there.
Yep.
We need nearby health facilities. It usually starts with a family doctor, right? So when something goes wrong, you go see your family doctor, you go see your dentist, you go see your podiatrist, ear doctor, eye doctor. In well heeled communities, they're always there. In
Mhm.
communities like Chester, it's a desert, it's a healthcare desert. Many people are up in arms about the absence of our hospital, but the hospital is always a last resort. And usually the most extreme cases end up in the hospital. But we all know that people were going to the Crozier Chester Medical Center emergency room for paper cuts because it was the only place they knew. So a healthy community also is not just doctor care, it's preventative medicine or just healthy lifestyles. So one of the things I came right out the box and saying is that I want every household to be no more than a 5 minute walk away from green space. Now this could be green space that you're kicking a ball or playing with your kids or just sitting there chilling out, in cut grass on a comfortable bench where you can clear your head of what might be going on at home or at work or in your love life. That's super important. So I really stress having my parks and playgrounds in the best condition they can be.
Mhm.
And sometimes you get hung by the tongue. Like, I don't know how I'm going to create an environment where every house is within 5 minute walk of green space. But just by saying that, I'm going to say the magic of being hung by the tongue or the magic of words seem to manifest itself in just magical ways. So this year we have a relationship with the Philadelphia Horticultural Society, where for the first time they've come out of Philadelphia to do this program where they take empty lots. And we've identified many of them. They want to do 100,000 square foot of empty lots where they're just going to clean them up, cut them, surround them with fencing, not cyclone fencing, but split rail fencing, which will make communities look better. There will be less lots that you'll see abandoned cars or illegal dumping. Some of them are right between row homes where that one house is gone, so
Mhm.
it will be infill. Wait till you start seeing that. That's going to start happening this spring. they're so excited to work with us. They've already offered us another 100,000 feet of these open spaces. And the deal is going to be that because it's going to look so attractive, we know that developers and people who want to build houses, when they see that, they're going to say, hey, I can put a house there. And we're going to say, it's for sale. You can do it. But you have to, in taking away this empty space, go somewhere else in the city and recreate that space somewhere else. So that's going to be a requirement.
That's great. That's good. I like
I
that.
could answer that question all day long,
I know.
but I know you have something else you want to ask me.
No, it's okay. I mean, I know that, health is important to you and the health of your constituents is important to you. And I love the walk, the being able to walk within 5 minutes to get to a green space, I think is important because we underestimate the power of just the earth in its natural state. We don't take advantage of it enough. I actually started taking walks at the beginning of the year in one of the state parks in Delaware. So every morning I drop off Noah, I take my walk, and that's how I start my day. And it's like a river that flows through it. That's just a beautiful time that I get to spend. And so it'd be great, to see more families having the opportunity to do something like that on a consistent basis. It's so important, just reconnecting with nature. It's so much healing there, and it's just quiet and just great. Well done. Well done. In your conversations with Chester residents, what would you say is the single greatest health challenge that's facing the city?
Yeah, I just got to go back to the big two. Number one, affording health care and having health care available. So how do you remedy that? I mean, it goes beyond what we can do in City Hall. We have to have people who are affected by this and people who represent those who are affected by this to rally and organize and hit up your state reps and take it to Harrisburg. And then from there, you take it down to the federal government, but you really have to stay in their faces and let them know just how important it is. And there's organizations in Chester that do that on a regular basis. You really just have to just make it plain. I really love the rally that went on last Saturday, right there on 9th and Curlin. Now, I'm not going to stumble and get the wrong group that organized it. But in any case, they brought with them people who are suffering with various, maladies, here in the city. And they spoke their story. And it's so compelling. When you see people like that, you can't help but to want to help them. Mm-hmm. So the stories that I hear mostly is more sad than happy. And that makes me sad. Mm-hmm. The people, Chester is a high Medicaid type community. And for those of you who understand health insurance, Medicaid is one of those ones that when you go to the doctor is not going to get the rate that he wanted or the rate that he advertises for that service. So many times the doctors were either not take that patient seriously. And that's a problem. Mm-hmm. That's what the issue was with Crozier Hospital. It was so much, what do they call them? Safety net hospitals. Hospitals that do cater to the lower income and lower insured, patients. And they almost become their own worst enemy. They want more patients to come in, but with each patient that's coming in that they're serving, they're earning less and less money. That's why private equity, the prospect came in and says, hey, I can save you from this. I can infuse a lot of money. I can give you some money right now if you let me run your hospital, only to find out that the money that they put up front to come run your hospital was a ruse, was a ploy for them to have control of the entire system, which they end up just sucking out, for themselves. We have to find ways to ensure people, well, let's not just call it insurance, but to ensure that people can get health care without having to go through the normal process of finding a doctor. What you guys do is the best way to do it. And, some people call it just mutual care or just being right there, giving people the basics of evaluating where you are right now. Like so many people don't get that checkup, don't get that blood pressure check, don't know what their cholesterols are, don't know what the prostate PSAs are. unless you know the basic things that are going on in your body, you don't know how to address it. We can deal with that later, but we need to identify what's going on out here. And unless there's organizations like yourselves who use your resources and combine it with someone else's and find a grant here and show up at fairs there, so many people who find it a burden to just check on their basic, what's my health today, is impossible. George, I was just again listening to you talk about your blood pressure. So obviously you two have a relationship, and I can just sense from that blood pressure is a challenge for you.
Yes.
And you get it checked frequently. And a running joke, which really isn't a joke, but I kind of miss the summertime in Chester because every outdoor fair, you guys are showing up with like basic health services, or you're contracting with somebody, or somebody's coming in there, they're doing blood pressures, they're doing, the various simple checks. And people would ask me, like, your job, man, I know it's stressful. How are you handling it? I says, I handle it by showing up at every street fair in the city
You really
and
do.
never walk past a blood pressure cuff.
Mm-hmm.
And
Right.
they're putting it on me. And I'm really excited to say that it's right there, not too high, not too low, usually, right where it should be. I I'm not going to get that frequency of checks any other way than it's showing up in my community.
Mm-hmm.
I'm not going to the doctor, every week of the summer. I'll go there twice a year, for a checkup,
Mm-hmm.
and I've added it to twice a year. But I also have the luxury of a really good health plan, so it doesn't burden me financially. I was in a pickle a little bit trying to find a doctor after Crozier closed, and
Mm-hmm.
I have to be honest with you. It was the luxury of having friends who had family members who were doctors that made it easy for me. Because when I went through the regular process through Dr. Motley's program, they were telling me that I could go to Mainline or Jefferson or wherever system I wanted to go to. But that first appointment was 6 months away. There was no way around that.
Mm-hmm.
And, fortunately, I've been relatively healthy, but I did have a surgery this summer. And
Mm-hmm.
that would not have happened if I didn't have the access, to health insurance, to early diagnosis, and to, thank goodness, the ability to be even driven to Jefferson Hospital, dropped off. You get the procedure, you come back home. Um, what used to be just regular, ordinary um, health checks have become luxuries and of life, and that really shouldn't be. But it's you guys. It's the mutual aid. It's getting the pharmacies to come out of their little storefronts and coming out on the streets. It's the medical providers who have the medicines or the equipment that need to be in people's hands to literally put it in people's hands. And it's groups like yours that make that happen for communities like ours. People have to feel comfortable talking about their health.
Yes. Yeah. Oh wow. Okay. Glad you noticed. Glad you noticed. Glad you noticed.
He noticed.
Nah.
Thank you for the shout out. We are, we're trying to do our best. It's such a huge need, especially in Chester and in other marginalized communities around this area, throughout the county, and you know, wherever we can make a difference, we will absolutely show up. But you talked about Crozier a little bit. We know that Crozier closed its doors. It was almost a year ago. I didn't realize it was that long ago.
Wow.
Um, but there was a winning bidder for the auction that had been found. Is there anything you can share about the new buyer?
I'm excited that someone bought the property. I'm excited that the person who bought the property, although a realtor, and you have to look at this first as a real estate transaction, there's a
Mm-hmm.
property for sale, a realtor bought it, period.
Mm-hmm.
Now, we are thrilled that the person who bought it wants to transform it back into a place that's going to provide health services.
Okay.
That's good. And
That's
we
great.
applaud that. We
Right.
applaud that. Now,
Mm-hmm.
how is it going to happen? Is it happen? What's the chances of it happening? What's the likelihood? What's the timeline of it happening? I'm going to tell you right now, the timeline, and that's what we need to be prepared for, is not next week, next month, or next year. It's
Mm-hmm.
going to be at least 5 years. before something comes back up there that will serve to replace the Crozier Hospital as we knew it. What will be replaced is not Crozier Hospital as we knew it. What excited me about meeting the new owner is that he came with his medical professional, the guy who's going to be kind of reimagining. He wants to call it reimagining how healthcare would be delivered to a city or to an area with a population like Chester. They just call it urban. This model doesn't exist all over the country because it's almost like department stores. The big box store or the big box hospital has been the model ever since hospitals were born. But one of the things I learned is how many surgeries, particularly surgeries, are easily done in outpatient settings now, where they used to have to go to the hospital and take, many of these surgeries, and you sit around for a couple of days to get monitored. They want to check you out. That was the norm. Now you just go in, they do the surgery, you go into a recovery room, and within hours, you're sent back home. The only way that this is going to happen, as much as I saw the plan and its design and its layout, you can only get excited. Remember, these guys are realtors, okay? They're not medical professionals. So they have to get the idea that they shared with me and sell it to the people who can bring the medical services to Chester. Fortunately, we're in an area where you have a Jefferson, you have a Mainline, you have a Penn Medicine, you have a Christiana, you have Temple, you have Rothman, you have all the pieces, all the players here. But can these guys who bought the Chester property convince those guys to bring services, a piece of what y'all do down to Chester, assemble, they're doing the real estate pieces, right? They're going to build the building. They're going to make the space. Will you guys come and play with us? One of the things that's really interesting about that is, in my mind, and this has only been a year, right, in the making and trying to figure out how this is going to be, I would think that one of those medical providers would be the winning bidder, let's say. Let's say it's Jefferson or Mainline, like, okay, we're coming down with our stuff and we're going to present this. And what these guys are saying is, no, that won't work. We really need these guys to partner, not so much with each other, but partner with us, the realtors, to fill these spaces, to deliver the services that's needed. Now, what's basic is, there will be an emergency room. There will be patient rooms available, but not the number of like 250 or 280 that Crozier used to have. It would be scaled down quite a bit. Not every service would be provided in their scheme of things, because the one thing I wasn't hearing, and things could change based on, how time comes out, but I said, I don't hear you saying that babies are going to be delivered here. And they were like, no, they're not. I was like, oh. They were like, no, the big surgeries still have to go to the big hospitals. Not that maternity is a big surgery, but it's something they see being done, elsewhere. And then I got right back to the community level. I'm like, like I said, people with paper cuts were going to Crozier Hospital to sit in the emergency room to get a Band-Aid. That's the wrong place to go for that type of care. You want to go to your family doctor for that checkup. And I'm saying Chester has no primary care physicians. How is that going to be addressed by what you guys are creating? And the one thing that he reminded me of is that nurse practitioners are almost replacing the family doctor in communities. Nurse practitioners have the ability to write prescriptions. Nurse practitioners probably have better bedside service than many doctors who have been trained as doctors. Like the family doctor as we knew it may have to find another job within the health profession when nurse practitioners are less expensive, more flexible, and even better at the job than a lot of your family doctors, have been. So what we're going to see is a reimagining of healthcare. I just hope they can deliver, because not only do those medical partners have to agree to come and play along, they're not bringing money. They're just bringing their medical services, their specialties. This realtor group has to find money from elsewhere, to make this all happen. It's a lot to ask. It's a huge endeavor. he's definitely got the right partners. He's putting together an advisory team of some of the people who have already been in this space advocating. He's got the best chance of winning. It's just a matter of seeing if he can win.
Mm-hmm.
I hope so, because
Yes.
the thing that's really helping this cause, though, is Riddle. Like, we know that Riddle Hospital is the closest one, and many Chester people are just riding out to Media or whatever we call it, Middletown, and they're swamped. They're swamped. You know, people are arguing they're not staffed. Well, no, they're staffed for what they are used to. You know, but people are getting 8-9 hour waits in the emergency room, and the people who were typically served by Riddle are mad. They're mad that you Chester people are coming up the road and
Yep.
taking up their time, taking up their doctors, taking up their beds. And it's thanks to them, you know, their anger is very effective in making the push to get this hospital or something like it back here in the Chester area, because these people have to be served.
Right.
Absolutely.
Wow.
Yeah, so yeah, we are definitely hoping that that they identify an operator and they get the ball rolling, and we get some reestablishment of acute healthcare delivery back in Chester, because it is so densely populated. This whole area is in need of a hospital for sure. So hopefully they can make some sweet deals and make it happen.
So, to the point of like getting people with, I don't want to say pitchforks and tiki torches, but it's almost like that. Like, people have to come out of their houses when this group shows up with the community meetings, which will be held in April.
Mm.
We need the community out there.
Mm-hmm.
And one of the things that the realtor side of this 2-person visit to City Hall, we had the realtor side and we had his doctor, you know, talking out of two sides of their mouths, one talking real estate, one talking medical, but partnering to bring services here. He's like, I want to have a community meeting, Mayor, with like Chester and Upland residents. We can do that. Let's do that. And he said, yeah, we want to have one big meeting. We can just air. I said, you're not having one big meeting. You're going to have several small meetings,
Right.
because everybody needs to be heard. Everybody will want to feel an intimate connection between you and your group. We don't want one big meeting and then you're gone. So had a phone call with him today, and I can tell you he keeps up regular communications every 2 or 3 days. They're calling, they're asking. So he's like, how many people do you think will come, you know, for the first meeting? And I said, well, there's going to be between 100 and 200 for sure. That's
Mhm.
for sure. So they're, you know, he says, well, and I can almost tell you right now, the space will be Widener University. So Widener's like, they got a space for 150 and they got a space for 500. I said, go for the 500. But when people come in, we're going to move them to the front. They're not going to be sitting in the back. And as people come in, you know, if it fills up to the capacity of 500, we'll just have a full room of 500. But they do want to hear from us, and we need to be there.
For sure.
Absolutely. So Delaware County has started a health department. Oh, first, shout out to B Miles. I see a comment from B Miles who said thanks for what we do for the community. So shout out right back to you. We got you, B Miles. Thanks for tuning in. Delaware County opened a health department a few years ago, and you decided to maintain Chester's Bureau of Health. And so just wondering, why is it essential that the city of Chester plays an active role in the health of the city citizens, as opposed to leaving it to other entities, hospitals, and other other organizations?
Mhm.
That's a really good question.
That is a great question.
Well, thank you.
Yeah, that's really good. A lot of it has to do with Sister Rosetta Carter, right? She had been representing the city for years in that space.
Mm-hmm.
She was the one that people would call when they had questions about their health care. And she was the one example of someone in city government that helped people have trust and believe in city government, because if they could reach her, if she would be there to answer that phone, and she always was, she was in the answer. I'd see her in the office answering those calls. She was always delivering. She was the one who maintained and got started again that board of health, which I didn't understand at all until I came on council. We knew there was a department or bureau of health within the city, but I also heard of this thing called the Chester Board of Health. And I'm like, what's the difference? Or is it a different name for the same thing? Until I joined one of those meetings. And it's representatives like Dr. Kristin Motley. There were doctors, there were healthcare providers of all sorts who were just dedicated to helping Chester with the problems that we deal with in healthcare. They were sort of an auxiliary arm to the Chester Health Department and Miss Rosetta Carter. Miss Rosetta Carter, you know, I won't say unfortunately, but a part of life is aging and retiring. You know, so she was preparing for retirement, and the money that the city was using to pay her was really a grant for COVID, which was running out as well. By all normal ways of doing business, especially in receivership, where every dollar counts and every dollar is being looked at, the health department was done. It was over. The COVID money was done. Miss Rosetta's ready to retire. We could easily just, you know, honor her wishes and put her out to pasture. And I'm like, no. You know, Chester absolutely needs someone in city government or someone within the city of Chester that's going to represent them, that's going to hear from them, that's going to serve them. So, you know, my job, and although Dr. Motley says let's try not to conflate what she's doing here today to her role in city government. Like, she was the only person that I knew could deliver with her skill set, with her commitment to the community over the years. And if I couldn't get her, then I would have punted to the county. I absolutely would have. And boy, you know, I will brag that was the most difficult hire I ever made, down to the point that I called her husband and says, please, will you talk to her tonight or tomorrow? And, you know, it was a very professional process. Like, she came with some serious demands, and we negotiated and agreed on how she will work for the city. And it's working out great. And it's working out really good. She's overperforming in her role. She even told me what her title should be, and we made that happen.
That's the
my role is mayor. The people who work for city government, their main thing, you know, it's not their main thing, but in any job situation where you have a boss, your job is to make your boss look good. But your boss has to make you look good by giving you the tools you need to do your job well. So if that relationship is working the way it should, things will work out. I also knew that the health department of Delaware County, you know, that they just formed was just that, just formed. I was very disappointed that the headquarters didn't come to Chester. It went, you know, somewhere else other than Chester. I didn't like the answer they gave as to why they set up their Delaware County Health Department somewhere other than Chester. So I was already mad at them. Okay. But the hope was that, you know, the fact that the county has a health department is far better than not having one. The information that they can get doesn't have to be fought for at the state level. And over time, you know, you can just hope and wish, especially with the leadership of Dr. At the county, Dr.
Laura Warner.
Not Dr. Laura Warner. She's a great leader. No, I'm talking about on council. Monica Taylor.
Oh, Dr. Taylor.
Dr. Taylor. Like,
oh, yeah.
Her project, and I knew she wouldn't fail. But Chester's needs are unique. They're unique in the sense that our disparities of health is just so high. We have to have a presence within the city because as much as we would want the health department of Delaware County to serve us, they would, if they did it right, they'd be robbing the rest of the county of services. So we really need to step up and represent, for ourselves. It was shown very easily during the COVID when we did not have enough testing. And when testing started, it was way late. And the numbers were showing that Chester weren't having weren't showing cases of COVID. And I was arguing from the very beginning, oh no, Chester people have COVID. They're just not getting to the test so that we can see how many people have COVID, So yeah, thank God for the Delaware County Health Department, but the work that has to be done in Chester has to be done in Chester, and then we partner with them.
Thank you. Another thing I was thinking about, which is another big issue in the city, is mental health. We talk about that a lot on the show. What would you like to see done to address the mental health challenges that our residents face? Any thoughts about that?
Yeah, mental health is. I was just talking to a gentleman this evening, and we were talking about our family situations. And the reason we were talking is because we shared a very unique family issue when we were kids. And I says, yours, I very rarely hear somebody who has gone through what I went through. And it was great to talk. We talked about the trauma that it presented, to us. It talked about the challenges we've had with relationships as a result of, what happened to us as children. But even in our adult years, as we were dealing with it, it was like, just man up. Like, you might be sleeping 12 hours a day. That's almost a telltale sign of depression. But we didn't know what depression was. It was just man up, go to work, deal with your stresses with family, with work, with just being in difficult situations. When very easily in our health plans was that thing that says, hey, you could talk to a health professional. When it comes to mental health in a city like Chester, I look at it from I won't say number one, but one of the issues I look at it is crime and crime prevention. I have a very limited number of police officers. Many of them are not from the city of Chester. And when they go out on calls, more times, I won't say more times than not, but oftentimes they're running into a situation where it's a mental health crisis, not a crime crisis. Okay? And what I'd like to see happen is that, like some of the police officers, I think just recently, one of the police departments, they have like that component when they know it's a mental health crisis, someone else, a professional in that space, goes along and de-escalates or, provides options so that things don't get so bad. The other thing that we have to do is to be better at recognizing what mental health issues are. Some of the easy ones are just somebody just talking to themselves, sitting on a stoop. But the situation came up in the snowstorm. Everybody in the city knows the lady that was camped out in the bus stop right next to City Hall. And I've had long conversations with her. I probably know more of her history than many. But what is it that has a person prefer to live outside than to seek help in a shelter or, through other services? And unless we spend the time, with these people, with professionals, and have a place for them to go, these people are going to default to what's going on in their crazy, mixed up minds. I got to give all the credit to several people, and some of them in our police and fire department, who said to the lady and insisted, there's no way you're going to be able to survive at this bus stop under blankets, cardboard, and people dropping off hot coffee to you for the next 15 days of sub-freezing temperatures, and we were able to take her and get her care. We have to be able to identify it even in our own households. We have to be able to know where to get the help. And again, I go back to, we have to be able to afford the help, where health insurance is just so important in these cases. There could be all the help in the world, but if you don't know where it is, and if you can't afford the constant, and usually it's very constant, um, care that's provided, you're not going to help yourself.
Right.
Yesterday, I went to the spelling bee at Chester High School. It's so cool to see first and third graders compete and
Oh, yeah.
fourth graders compete. And I think it was I don't remember which group it was, but they were still in that young category. And there was this one kid who eventually won his category. But when he would be called up, when it was his turn, he'd get up from his seat and he would just kind of flail his arms and legs. And the first time he came up to the mic, everybody in the audience laughed because it was funny to watch. But by the second and third time, people realized, oh no, this guy isn't playing. This is who he is.
Right.
Okay. I don't know if it's autism, he's on the spectrum, but it was something that made this kid very animated. It was almost like watching a Pee Wee Herman or something like that. But the boy could spell. Okay. He didn't miss a word. He ended up winning the contest, and he got the biggest round of applause when he won.
Oh,
So we have the empathy in our town when we identify people who have issues that are mental related. We just don't have the resources to take them for help, and we have to feel comfortable. My first real experience in mental health care for myself happened after a very close friend passed away suddenly.
wow.
And everybody grieves differently, and that's what I learned from the therapist that I went to. But I went into amnesia and didn't know it right away. I went to work at the refinery the next morning. I walked out into the refinery after getting dressed and realized I forgot my wrench, my flashlight, my this, my that, my the other. And I was like, no, this is not safe. Something's going on in my head right now that is preventing me from even walking out onto the workplace safely. I've got to call out sick right here, get out of here, and seek some help. And unfortunately, I couldn't find someone of color. That's what I was looking for first. But when I sat down with the therapist, the first thing she said was, everyone grieves differently. What you're going through is not unusual. It's very common. And that's really all I needed to hear at that point, is that I wasn't losing my mind. I wasn't crazy. We had 2 or 3 other visits, but if it's yourself and you find yourself in a different headspace, sometimes you can kind of pre-diagnose yourself and get help. But it's really important for all of us to be able to identify others in our community, in our households, and get them the help that they need. It ain't those times anymore where you can just say, man up, because people are dying and don't have to, because we don't identify and recognize that someone with mental illness is the same as someone with cancer. It's an illness. It's an illness.
Right.
And it can be, it people can be helped.
Right.
Yep. Absolutely. And speaking about helping people, I just want to mention that if anyone knows anyone who is having a mental health crisis, a breakdown, thinking about any harming themselves, harming anyone else, or just need somebody to talk to, they may be anxious or scared or afraid, you can always call the mental health hotline, which is 988. So it's like the 911 for mental health is 988. So Dr. Orozco, you can pop that in the public chat so that people can be reminded and see it there. There's also, you also talked about finding a Black therapist. And so I want to share a couple of resources there. In this area, you can visit Black Men Heal, which is a Philly-based therapy organization. It's a nonprofit. They offer free therapy sessions. Their target is Black men. They have counselors that are Black men. They probably have some females too, but they absolutely do have Black male counselors, and they offer free services. And you can also, if you have insurance, you can also go to, or not, if you want to pay out of pocket, you can go to Psychology Today. So Dr. Roscoe, you can put the website for Black Men Heal on in the comments, and then a website for Psychology Today, which is psychologytoday.com. You can go there, do a search for a provider all over the country. So that's not limited to this area. You put in your zip code and they'll show you a list of providers. They put their pictures up so you can see what they look like, and they also let you know what insurance plans they take. So make sure you all check out those resources if you're looking for providers. And thanks for sharing your story, Mayor Roots.
Yeah, appreciate it.
So we're coming to the end of this. We know that Chester is a longtime environmental justice community. And so we're wondering, what are you doing about environmental health issues in Chester? Are you doing anything? And if so, what is it?
You started off with the word environmental justice, and boy, I rail against that term. I I was screaming and hollering at one point, saying, "Where's the justice?" I'm not seeing anybody go to jail. When I think justice, I think jail, and we're being polluted every day. Where's the justice? And we were at a session at the Access Center. I forgot what it was, but it was a black lady who, it was during a break. She came over, she sat next to me, and she says, "I understand what you're saying, that you're not seeing justice," but she says, you don't really know the definition of environmental justice and how it can help your community." And I was like, "Well, school me." And she says environmental justice is a money thing. I was like, "What do you mean a money thing?" She says, "Because Chester is designated as an environmental justice community, it gives you access to different uh, grants. It gives you preference. It gives you more points if you're applying for grants or different services." And, she really put it in an economic sense for me. She was like, if you're not tapping into these government programs when environmental justice was a thing, just lately, a lot of that stuff has been peeled back. She says, you're really missing the mark. So know what the real definition of environmental justice is. They're not trying to put anybody in jail. They're just trying to placate you with money. So don't leave any money on the table. Go get that money. But what's going on in Chester is a crime. It certainly is a crime. The biggest polluter by far, with pollutants that are really harming our town for the last 35 years, is that incinerator. There's no doubt about it. The more I learn about it, the more I get upset about it. You've got a company that's burning 7 million pounds of trash in our city every day. 7 million pounds. It's the first or second largest incinerator, we've been told, in the United States. My research says in the world.
Wow.
And the only other one that's of equal size is in Turkey, in Istanbul, Turkey. This facility should have, I'm not saying it shouldn't have been built, it shouldn't have been made, it shouldn't be burning 7 million pounds of trash. I will never say that. It should just never have been placed near a population center.
Right.
Nowhere near people. It should be far, far away. Now, air does travel, but you don't put that right in somebody's backyard. So what's going on now, and what's going on for the last 35 years? When it was first built, people were standing in the middle of the street trying to stop trucks from bringing trash in, but they were coming, and they continued to come. The fight has begun with, you're violating people by poisoning them with all this stuff that's being emitted, but the company that is there, they fight back as well. And they have experts who will give you studies to say, no, that's not the case, or you can't prove it's just us because you got that guy down the street, that guy around the corner, that guy across the ocean or across the river. So then they tried to, tighten up this or tighten. The only way you're going to get something like that out of our city is economics. You have to cut off the source of their fuel, which is trash. And that's what's going on right now in Philadelphia. It's time for Philadelphia to sign a new contract with where they're sending the portion of Philadelphia trash that comes to Chester. Now, Philadelphia is sending 2 million pounds of trash to Chester every day. New York's sending about 2 million pounds of trash to Chester every day. And the other big hunk comes from Delaware County. I will almost say that I wouldn't mind seeing a trash incinerator in Chester if it was just burning Chester trash. But in that big incinerator in Chester right now, that's burning 7 million pounds of trash a day, only 2% of that is Chester trash.
Wow.
Only 2% of that is Chester trash. If you do the math, it's ridiculous numbers. Like over the 35 years, that's 38 billion pounds of trash that's been burned out here. We have people who've been fighting it for a while. This is the first time in the history of Chester that government is fighting it. And you've got the mayor fighting this thing. I'm going out on the line. I'm going out on the limb. That business that's, polluting our city is also helping to keep our city financed with a host agreement that brings us about $5 million a year. $5 million a year, steady money. They cutting that check every year. Couple things with that though. It's that same $5 million every year. Shouldn't there be an escalator somewhere?
Right.
Shouldn't that money that we're getting be some proportion of the profits that they're making in that facility, of which they won't share with me or anybody, how much they're actually making out of that facility? It's a money-making machine. Not only do people pay them to bring them trash, they're making electricity that they end up selling. Not a single kilowatt of electricity that they've made over 35 years has come to your house, or my house. Wouldn't it be cool if everybody in Chester, every household in Chester, just got free electricity because we're sucking up fumes from the trash? I mean, even that would be like, you're kind of my friend. I don't have to get this Pico bill every month.
Listen, they wouldn't even let you shut it down if they was paying the
They would keep it
electric
up,
bill.
right?
Exactly.
Look at Chester, though. I mean, people come into Chester. One of the first things that they talk about is the fact that there's litter all over the place. Why is there even a gum wrapper on the ground in the city of Chester if the fuel for their plant is trash?
Right.
I'm not telling them to come out and pick up our trash. Like, litter is a mindset. Like, people are throwing stuff out of their car. They don't see. I mean, people are just crazy the way they litter in this town. But wouldn't it be cool? Like, somebody just came up the other day and says, "Hey, I got 2 TVs. Where can I take them? Or who's going to pick them up? Should I just hide them in a trash bag and put them in a trash can and watch them go?" It's like, no. But wouldn't you think a place like that trash incinerator would have a place you could just pull your car up and drop off televisions or e-waste, that type of thing, and have another lane that you can pull up with your lawn cuttings, maybe another lane that you can pull up with your compost or your table scraps. Maybe you just missed the trash man this week, and you can take your trash bag or 2 and put them in the trunk of the car and drive them and take them off. And you all know that we've been burdened in this city with illegal dumpers, right? Where they just come with truckloads of stuff and dump them in our parks and our back alleys, and city workers have to go pick it up. I laugh because it's almost funny. We pick up that trash, and where do you think we send it? Down to the incinerator.
Right.
Why do we have to have illegal dumping at all in our city when people should be able to legally take it down to the incinerator?
Yeah.
It could be called legal dumping. Imagine that.
Right.
Imagine that. It's a big fight. It's a big fight. There's a lot going on. Look at her. I can say something about that lady right there. Is that when she gets on the mic, she gets the sound bites. Like,
I don't know why.
You know why? Because you're saying what people want, what the press wants people to know, and that's the health impact of this. I just go up there and punch people in the face, and
you did punch want. About 10 people in the face.
That's not good for TV, but what you do is so important. It's so important because you're very measured and you're very real with the facts. Like, we had a great time explaining ourselves at Widener just the other night. I learned a lot from your presentation, and let me share some of it. Like, she was like, "Why do people get sick?" And people were just coming up with the normal things. And she says, "Well, there's that environmental factor too. And, so many people put on us that we're sick because we don't exercise or we don't eat right or we don't drink a lot of water, but it's the factors of pollution that are making us sick, and nobody's fighting those polluters. Um, it's a fight for justice. It's a fight for human rights. It's a fight for dignity. I am proud to be a mayor that's fighting for my people. You know, I don't want to be that guy that sends the letter to Philadelphia as the former mayor did. And I can only say this because I saw the letter where he says, send your trash to Chester. Come on, just send that trash to Chester. Because he wants to maintain that $5 million coming to the city. I understand that mindset, but this city is in bankruptcy. We're the only city in America in bankruptcy. This company has been dumping $5 million to us every year for the last 20, 25 years. It didn't keep us from going into bankruptcy. Okay. So do we really need you? Can we wean ourselves off of that $5 million?
Yeah.
Can I kick you into the water and replace you with a hotel that would serve the Philadelphia Union and the teams that come in? Will the west side of town be a whole lot more attractive for investing in if there's not a stinky incinerator right across the street? You know what I do on the west side of town right now? I add to the list of houses that I knock down and buildings that I knock down.
Wow.
I should be able to build over there. I get mad at unions. Now I'm from a union home and I love unions, but they're arguing that, oh my God, if Philadelphia doesn't send their trash down there, we're going to lose 1 or 2 workers. And I'm like, why are you so short-sighted? If that incinerator isn't there, it creates hundreds of union jobs because full communities are going to be built. Pipes are going to be coming underground. Streets are going to be built. Like, come on, let's get some real union jobs, putting houses together, hotels, condos. We've got the most beautiful waterfront that's untapped. Okay. And, you know, let's go to work. So I will take all the hits. I will take all the side eyes. This is a fight worth fighting. And one of the mottos that I have as I go around is join the fight for Chester. I don't care where you're from. Chester, Delaware counties, Pennsylvania, Georgia, Taiwan, wherever. Like, join the fight for Chester. And we're getting people that's hopping on board. And the citizens of Chester are starting to notice. You know, they're starting to realize that, you know, they have a mayor that's going to fight for them. We're not going to deal with every issue. Just this week, I'm getting a group of people hitting me up on, what about animal control? What about dogs in Chester? Hey, man, I would love to have some kind of animal controls, to have some kind of, because it's part of safety too. Like, we got some bad dogs in this town. We got some dogs that ain't eating just like people ain't eating, and they get desperate. But if I don't have a place to take a dog because the shelters aren't accepting, hey, y'all, this is real talk. They're not accepting Chester dogs. They're not accepting
What do you
Chester
mean?
dogs. I'm saying that the places like your SPCAs are not accepting Chester dogs.
Wow.
They're not accepting Chester dogs.
That's crazy.
It's as simple as that. If that dog is just across the line in Parkside or Brookhaven, and sometimes these dogs do get pushed over there and say, hey, this is from Brookhaven. Oh, we'll take it. They're not taking Chester dogs.
Wow.
And, you know, the question becomes, well, why don't you set up your own shelter? Why don't you set up your own kennel system? Like, that costs a lot of money. Hey,
Right.
George, I don't know where you live, but if down the block I set up a place where 200-300 dogs are just sitting there barking and, you know, trying to be served, is that what you want to see in your neighborhood? Like, first of all, we can't afford it. And,
Right.
and secondly, you know, like, not only do you kennel them, like, you have to feed them and you have to make sure they're not sick. Or do you just want a big animal crematory where you just burn every dog that you pick up? You don't want to do that either. You know, something as simple as animal control. We've had the money in the budget to hire an animal control officer, and we wanted to do that, but nobody's taking our dogs.
Wow.
That's messed up.
That is messed up. Wow.
That's messed up. That's a whole nother show. We
That's a
are
whole
way over time.
Oh, really?
We are way over time. But I do want to bring up 2 things you said, and we'll talk about this more in a couple of weeks. You're talking about the power of the people, and especially, you know, with all the work that Reverend Jackson has done, and Dr. Martin Luther King, and all the civil rights leaders have done. And I think we have to tap into our power. We have left power on the table, and it
Mhm.
is over. It's over. We have to activate our power. We have to use our power. You you, you talked about the patients at Riddle who voice that they don't want all these people from Chester and their ERs using up all their doctor's appointments, and their voices get heard. You also talked
Mhm.
about how the Congress didn't pass the federal subsidies, and so now we don't have any subsidies for the Affordable Care Act plans, and so insurance rates went through the roof. People can't
Mhm.
afford insurance. We have power to prevent things like that from happening. There are elected officials that get into place because of our votes, or because we didn't vote. And
Right.
so when we activate our power, we show up, we hold them accountable. Like Ms. Zuline Mayfield tells us, we need to do it. We cannot leave our power on the table. It is over. So y'all are going to be hearing much more about us getting involved in more advocacy efforts, because we don't change anything until we change the laws. And it's just as simple as that. And that's
Mm.
at the local level, that's at the federal level, and every place in between. If we don't change how things are operating, it won't get changed. It's on us. We cannot leave our power on the table. It is over, because
Well,
this country is moving in the wrong direction.
I forgot to give my little Jesse Jackson story, and I'm not going to do it now. But
Oh,
to your point, like guys like him, it we have to look at the work that they did, the effectiveness of the work that they did,
Mhm.
and the fact that these people do pass on. You know, they do get old. They don't. They've lost their fight and their power. This is like a relay race, guys. Like somebody has to take that baton and just keep
Mhm.
running. And too
Mhm.
often, you know, in all areas that we've talked about today, there's either no one to pass the baton to, or the baton gets dropped, or the next great person picking up the race starts from ground zero again. So
mm-hmm,
to your point of advocacy, that has to be just constant,
mm-hmm,
constant through every generation, starting very young, to identify those people and train those people to figure out which baton you want to take and run with, because there's
Mhm.
somebody doing great work in every area right now that work needs to be continued in many communities, or just continued, period. We can't afford to drop any batons, you guys. So that's the visual I want people to have. Let's
Mm.
keep the batons going.
Mm.
thanks for that. I'm gonna have to plug in my little 14-year-old into some of this advocacy work. So that
Mm.
just prompted me to think about being intentional about that, because you're absolutely right. We have to keep the relay race going, and that's how you do it, training up the future generations. All right, we are way over time. I just want to ask you really quickly, how can viewers reach out to you if they have concerns
Oh,
for the
don't
mayor of Chester?
don't be sending me direct messages on Facebook. I'll tell you that. Like, are you guys crazy? Like, I'm a mayor. You know, I have real outlets. Now, the easiest way to reach me is through email, and that's mayor at chestercity.com. That's the easiest email address to reach me. Now, people don't use email. If you do want to call, the phone number is, and I'm only going to give you one number, and this is the number you call for everything in city government. It's 610 447 7700. When you call that number, 610 447 7700, the first thing you're going to hear is a menu. It's going to say, if this is emergency, call 911. The next prompt, if you want to reach police or fire, hit number one. If you want to reach this department, 2, 3, 4, 5. My number is 7. I'm all the way at the bottom, because more times than not, when people call City Hall, they need to talk to those departments. You don't really want to talk to the mayor. You want to get your problem resolved. And if you get to me, it's slowing your process down from getting the help that you need. So if you've got some high grass growing next door, call the streets department. if you've got an issue with Parks and Rec, talk to the Parks and Rec department. To think that you can get to the mayor and that I'm going to expediently deal with your issues right away, that's not going to happen. Deal with the department heads. But I can be reached, and it's prompt number 7. If the call isn't answered by my special assistant, it will go on voicemail. He's amazing at jotting down all the voicemails, and usually he's the guy who takes care of the issues. I do have office hours as well. So if you really want to spend some time with me, I usually block out about 6 hours a week for people to come in. But we got to vet you first. I don't want you coming in with no craziness. But if you really have something that we believe I can help you with,
Right.
I want to sit down and talk to you face to face. We're on all the social medias. I would just say go to chestercity.com. And from there, you should be able to find, even my Facebook page, which is Mayor Stefan Roots. Everything is Mayor Roots or Mayor Stefan Roots. I think it's Mayor Roots on the socials. We know Chester is a Facebook town, so we do put a lot of content on Facebook. We also have a mobile app. It's called Chester City Connect.
Mm-hmm.
You can download it on Apple or that other platform. What's the other platform called? Google. Okay, great. Yeah, it's a free app. Within the next few months with that app, you'll be able to pick up your phone like this, take a picture of that abandoned car, take a picture of that high grass, send it to the department. You'll be given a ticket number. You'll be able to track all the activity that's being done to resolve your problem. But get the app now so you'll get familiar with it. You'll get notified for everything. So we're communicating in both directions, out to you, and we want to hear from you. That's why we're down to that one number. We only need to memorize that number, 610-447-7700. We'll resolve all your issues within city government.
Very, very, very good. Very good conversation. Thank you so much for your time. I know you must be exhausted. Long day. But we do have one last question for you. What is the podcast that keeps the community entertained and informs on important health topics?
Yours.
Yeah.
What? Was that a trick question or something like
No,
that?
wow.
So what's the name of the podcast? Do you even know the name of the podcast you're on right now?
I don't. I know the topic, the wealth.
Keeping it 100. Come on, give us
keeping it 100. I should have known that.
Right.
I've been saying that all day. Keeping it 100, keeping it 100, all the variations of it.
Thank you for joining us. We really appreciate it. And shout out to G, because it was G's idea to have you on. So thanks, George.
That's my guy. Since he started. I've been in the trenches with him, and I appreciate everything you're doing. And I see the progress, man. We're just picking up the rubble, so I get it.
George keeps it real. Like there's no funk, no faking his funk, man. He gets right in my face and tells me what I should do, what I shouldn't do, what looks good, what looks bad. And what I love about George is that, even when I kind of school him on what it looks like from my perspective, he takes it like a man. He says, "Oh wow, now I see why y'all moving like this, y'all moving like that." Sometimes it's not everything that you see, guys. Let me tell you, there's a lot going on around here.
So there it is. Roots, there it is.
Roots, there it is. Ew, that's hilarious. Thank you so much for joining us. And shout out to Frances. Frances is working behind the scenes. She's doing her thing. Thank you so much. But we just want to give you a quick couple of updates what we have coming up. We also have our blood pressure program that's running. We'll be starting a new cohort next month. So visit healtheducated.org to sign up. Miss Simpkins is still running her Black History Month exhibit, so make sure you check that out at the Cat Center on 4th Street. And we'll be at Better Tomorrow in the new homes on Friday. They're having a health fair for their residents from 10 to 2. So if you live in the new homes or know somebody living in the new homes, come through, get your blood pressure tested, get some lead information, sign up to get your home tested for lead. We have a lot of resources. And Saturday, we're canvassing. We're back hitting the streets, door to door. We're going to make sure our people know what they need to know about lead and getting connected to resources. So please sign up to help us canvass. You can go to the website, healtheducated.org, to get more information on that. But yeah, I'm tired. That was long, but it was it was good. It was good.
It was. And it makes sense. It was the mayor. So
He can take all the time he needs.
He, like a public state address of it,
You just gotta hang in there.
It's just
No, that was great. It was great. It was a good conversation.
Yeah.
So thanks again, G, and we'll catch up with y'all next week.
Yeah. All right. Keep it 100.
Keeping it 100. Truth with no ceilings. Keeping it 100. No cap, just vision. We speak it, we live it. Your health is our mission. Keeping it 100. Facts versus feelings. Keeping it 100. Truth with no ceilings. Keeping it 100. No cap, just vision. We speak it, we live it. Your health is our mission.